What's going on, folks? It's your boy Metal, TinMan TNA podcast and YouTube's coming to you here for a video on the IFAKs as well as a bonus little boo-boo kit video here. Make sure you are getting training on medical, on first aid, on how to take care of any issues you may have, whether it be trauma or it be simple scrapes, breaks, lacerations, whatever the case. Make sure you're getting proper training. I always talk in the podcast about making sure you're getting training. Well, I'm here with the little table, my Seahawks pants, to tell you, get that freaking training. Get your training in medical. Learn how to do this stuff. It is very important. It is literally life or death, okay? Starting off here, this is the first aid kit that I keep in my ruck. It stays in my Claymore pouch, as you've seen in the ruck breakdown video. I have this first aid kit. It is nothing super fancy or anything. I have some sterile gauze. I have some bandages. I have some ibuprofen. I have gloves. I have Benadryl. I have some Imodium in here, anti-diarrheal. I have Providone iodine infection wipes, to keep you from getting infections. Triple antibiotic ointment. I have burn relief gel, lip ointments, sting wipes. I have some sunscreen in here. I take and I keep these in these little plastic tins so everything stays protected. Then I have my bandages, fingertip, knuckle, little junior plastic bandages, little ones, 2x4 knee bandages and elbow bandages, things like that. Help you on your heels, your Achilles tendons, things like that. All that here in the bottom. So I keep all this stuff just because you never know what kind of crap you're going to run into where you need some type of mini first aid. And I keep the gauzes in here just because you never know when you're going to have to stop a bleed. Okay. So that's just a simple basic first aid kit. Like I said, Benadryl and Imodium and some ibuprofen in this guy. Okay. Very simple. That's what I keep in the top of the rucksack. Now, IFAKs are generally like a trauma type kit. There are many ones out there. There are many different kinds. Many, like the small little blowout kits or just a tourniquet or something like that. Then there's like these bigger ones. These are all basically based on major injuries, not based on boo-boo, scrapes, cuts, stings, burns, things like that. That's what the first aid kit's for. That's what a boo-boo kit's for. I have in this kit, this is one just goes on Molly, just a regular GP type pouch. Jotted down some stuff here. I like to mark on the outside of my IFAKs the side the tourniquet's on. So that way if somebody does have to grab in here and get a tourniquet that's not me, they can see what side it's on right there. Also have some information in here, my name, that I also have a boo-boo kit in here, my blood type, things like that. Now inside here, I do have another boo-boo kit because this one is kind of like a standalone grab and go kind of kit. That way I have a boo-boo kit in here. I also wrote on some more medical information on the outside here. I also have CAS cards and stuff I put in here, but I took those out for the video because y'all don't need to see my personals. I keep a pill bottle in here that has different types of pills for pain medication, for antibiotics, things like that I keep in here. So I keep a pill pack in here should I need it. Same type of thing, Imodium tongue depressors, tweezers for getting out splinters, some more elaborate type stuff, some different first aid creams, different sunblocks, different burn gels, some medical tape. I also like to put in my first aid kits and IFAKs steri strips. These things are great for helping to close wounds. I keep this a little bit more elaborate than the other one, just because this tends to go with me whenever I am going to be traveling. So I take this one with me, and it bright orange should I need to signal. You've seen the survival videos, signaling for rescue, things like that. Now, inside here, these IFAKs are basically about the same, right? They have all the usual suspects. You have your tourniquet. I have this staged, ready to go. A pair of EMT shears, easy bandage, right? Compression. I have some gauze in here. I have some ACE bandages with the I can't think of the name of it, the closures for the ACE bandages in here. Obviously, in IFAK, you don't see everything torn apart because you're keeping it sterile. Some crinkle gauze. In the back here, I have my chest seals. Behind those, we have nothing. I put an extra chest seal in here just because I like to have an extra one because I'm traveling with this, and if one goes bad, I have a third one there that I can remove and reapply one should I need for somebody. I also keep a trauma pad in here. I keep a Sharpie for marking a tourniquet. I don't know why it made its way over there. Probably whenever I repacked it, I put it over there like an idiot. But anyway, trauma pad, steri strips. I keep those hot hands. Keep them in here for Kaz in case I need to warm somebody up. I also throw in here a little thing of purified water that is for, it's an ophthalmic solution for eye wash. You'd be surprised how many times you run into situations where people get stuff in their eyes. This works good for flushing it out. Also works for flushing wounds should you need to get anything out of the wound. And I keep since I couldn't put it in the first aid thing, I put it in here, little tube of triple antibiotic ointment. I like to have that stuff on me just in case I need to treat a small cut, abrasion, something like that. I have it available. If I don't, then it's in there in the other first aid kits. But if I don't necessarily need it, it just rides in here, and I don't have to go digging through everything to get to that antibiotic ointment because I have the little tubes in there. But if I run out, I got more in here. So that's the takeaway kit, the one that that travels with me if I need to go somewhere, and I would like keep that with like a get home bag or something like that. I could take it, I could throw it in the top of my ruck. If I need an extra one, I have it right there ready to go. Now over here, you see I have TQ side, metal, all the info on here. Then we have the IFAK. This is on a tearaway. This is actually made from a company called Sherber. They make really good equipment. I have an EMT bag from them that I keep here at the house with all the bells and whistles and everything you could need. Different airways, all that kind of stuff. My wife and I and my daughter all have training on this stuff, so we know how to utilize these things. With this is what I keep on my battle belt. I have opted to, when I do another battle belt, to have a smaller like blowout kit that I would keep on it, but this is like a general IFAK, okay? Now, that one that I just showed you, I have had for several years. I've only had this one for about 2 years now. This one has some different things in it than that one has to a degree, only because that's what it came with. The other one came with a couple things, and I've built it out from there. So in here, this one opens up a little bit more. This has a roll of duct tape because medical tape doesn't always stick. EMT shears. I have in here a triangular bandage or cravat. So that way, in case I need to make a sling or something. I do have compressed Z-folded gauze in here. I have a pair of hemostats in here should I need to pinch something off. I have a hemostatic dressing in here that has the quick clot permeated into the gauze itself for packing wounds. I put in here a thing of moleskin because it is very helpful for dealing with many different things. If you study up on it, you can use it for a bunch of different things. That's all it has in the center here. On the other side, as you can see, just chilling right here is the stage tourniquet, ready to go. Then I also have an Israeli bandage here, ready to go. The Sharpie, ready to go for marking on the tourniquet. In this pouch, you're going to find an MPA with the lube taped on. That way, I'm not trying to shove this into an airway or have it shoved into my airway without lube on it. It sucks. In a pinch, you can use spit, you can use blood from the victim to get it to slide into the airway. It's not recommended because then if you're looking at it, is that dried blood from the person bleeding, or is that from their airway? What is it from? So I'd rather just use the lube and be done with it. In here, I also have a couple combine pads. This kind of stuff too, even with the lube, you can utilize it in survival aspects too. Just keep that in mind. More than just medical uses for this stuff. And then I have another pair of hyphen chest seals in here. Then as I make my way back over to the other side, as I throw some of this stuff in here to save some time when I go to repack it, I'm gonna shove a couple things in here just to save some space since I'm stuck on the little table still. Been really busy doing all kinds of different stuff, and 'tis the time of the year coming up on Thanksgiving and Christmas here soon. So things is getting busy. Anyway, on the other side here, there's this little fold out thing, right? Has a little zipper compartment. Inside here, I keep a pair of gloves. Should I need nitriles for working on somebody or somebody to work on me, I have them here. I do have in here some more gauze, like I had in my other IFAK. I keep in here, just in case, chapstick with the cotton ball in the top, with the lighter, so in case I need to start a fire to treat somebody, keep them from going hypothermic. I got the survival blanket in here, and I have the hot hands right here to get them warm up so I can start a fire to save somebody, to keep them from going hypothermic. And then I have a pill pack here that has naproxen, ibuprofen, things like that in it. Should I need to treat, I have that stuff for pain. So that's the IFAK. You want to keep your IFAKs as simple as possible if you can. I have thought of a myriad of different things that I can use this stuff for, and this is the basics of what I need. It kind of gives, this IFAK that I keep on my battle belt currently gives me basically like a micro field hospital, so to speak. I don't carry the boo-boo kit in here because I have, you know, all these different types of gauzes and stuff, and I have tape that I can tape and make my own band-aids and plasters. I don't necessarily need to have all the extra stuff like I have in the boo-boo kit, so that's why this stays on my belt. The orange boo-boo kit, I keep in that because I can take that whole thing and go with it. The little red one I keep in the top of my Claymore pouch of my ruck, just so I can treat whatever kind of boo-boo I may encounter, right? But I can also look at the aspect of, okay, if I'm just in a ground and pound kind of roll, yeah, I have a little bit of stuff here. I can make up basic band-aids and stuff like that with this stuff. But I'm looking at doing another one of the Altoid stins, that type of kit to have with this specific IFAK. So I have a micro boo-boo tin with this. IFAKs are great. They help a lot of people in a lot of ways, but you know, all the stuff you have doesn't really do much good unless you get the training to use this stuff. This is the most important thing. Like I said, I talk about it in the podcast. I talk about it here before. Get that training, not just firearms training and tactical training and all the cool guy stuff. That isn't going to amount to much whenever you need to save somebody's life, right? You can shoot, move, communicate all day long, but if you can't stop the bleed, it's not going to be, it's not going to be a good day for somebody. And hopefully it's not you or one of your homies, right? So make sure you're getting that medical training. There are people out there that if you just ask, they will teach you how to utilize this stuff, right? You can take courses. Highly recommend doing that. Yeah, thanks for tuning in, guys. This is my short down and dirty video on the IFAKs and boo-boo kits. I hope you guys are having a great day, a great morning, great night, great afternoon, whenever you're watching this video. Make sure you're liking, subscribing, doing the things. Hit the bell for notifications. Make sure you're getting in the comments and talking to us about your IFAKs, what you have staged in yours, where you found training, what you're able to do, you know, with the training you have. If you found like a slick trick for this, that, or the other, throw it in the comments. Maybe somebody else will learn something from what you're saying. Keep the positive, keep the good stuff going. No down in the mud, down in the dirty kind of stuff. Let's keep it positive, guys. So enjoy. Make sure you're subscribing, following the podcast on Spotify, getting into the Twix and following us over there on X. All the links are all in the descriptions and bio here, so make sure you're finding them. So until then, next time, Metal out.